Another topic of great interest is the age at which point we feel as facial plastic surgeons patients should come in to consider aesthetic facial plastic surgery, and in particular, facelifting of the jawline and neck area. And so I'll always tell people that the earlier you can come in to get to get an evaluation, get information about what the process entails, and potentially consideration of actually doing the procedure, the better it is from a technical standpoint, from a longevity standpoint, and also from a standpoint of the most natural and less dramatic result. So, in an ideal world, most patients are thinking about getting some sort of surgical rejuvenation procedure somewhere around their 40s and early 50s. I think that's probably the ideal age. You're relatively healthy, you have a good soft tissue envelope underneath the skin to support the skin as the deeper lax soft tissue is lifted. You will have a more robust healing response in relation to the surgery. And as you're healing, as your body is responding to the injury and you're healing, you'll actually have better tissue response that will lead to longer term benefit in the skin. So my recommendation, generally speaking, is that patients in their mid to late 40s, early 50s start thinking seriously about getting a surgical lower facelift and or any eyelid procedures that may be necessary based on their particular face, age, ethnicity, and other hereditary or genetic predispositions that sometimes we can see at earlier ages than expected. I think that patients will look a little will get their achieved appearance, which is taking them back about 10, 50, maybe even a little bit more than that years back, in a very natural way that doesn't change things too dramatically. People generally won't notice that you've had anything done, but that's the way that you want to go through this process. You want to look the same age for a very, very long time, and so that's I think procedures done successfully are done earlier on, and done in a fashion that allows for a beautiful natural rejuvenation without any telltale signs of having work done, like thick scars, scarring that pulls down on earlobes, any pull or stretch lines, contour irregularities that could potentially give away that you've had basically bad work done. So if you go to an experienced provider, practitioner that does aesthetic facial plastic surgery, that is very mindful of where the incisions are placed, how everything is closed, the lifts up the soft tissues in a very natural way that doesn't lead to weird, strange and odd sweeps of the tissue where some areas are tightened, others are not. I think that those are all really important factors for a really excellent result in your sort of midlife, so in the 40s and 50s. With the understanding that as you get older, you still go through the aging process, and that you may need additional tuck-ups or other procedures, even revision facelifts, maybe sometime in your mid to late 60s or early 70s. So hopefully that gave you some understanding of the things that you need to be considerate of, and also know that surgery, when done right, is actually some of the most natural looking rejuvenation procedures that are offered in this day and age in the world of aesthetics and cosmetics. Please let me know if you have any other questions about that. Always happy to see you in consultations. Never too late or too early to get a consultation, I should say. So please let me know if that's something that you might be interested in.